Now we have Miss Lorraine, the gorgeous Miss Lorraine. How are you today?
I'm very well, thanks, Susie.
Excellent. What brings you to Guys Support Nurture for today?
Well, I've actually been looking at the treatments that Claire's been doing and having great success, so I thought I'd come along as another test patient for you all to see how we go with today's treatment for a newbie. So,
excellent. And you've had treatments before?
Yeah, I have, and found it very, very successful.
Okay. And is there anything that you've got going on in your body that you'd like the therapist to focus on?
Possibly neck and shoulder.
Yeah. What's been going on?
I've had a neck and shoulder back problems for a very long time. It sort of comes and goes.
Yeah.
It can be quite intense at times, and then it'll release when I have some treatment. But it's sort of a bit of an ongoing thing. Yeah.
How long do you reckon you've had the pain?
I've probably had neck and shoulder pain for probably 30 years.
Yeah.
It's probably the best it's ever been. It never completely disintegrates.
Yeah. Okay. And what other therapists or what other treatments have you had in order to alleviate it?
I've had network chiropractic.
Yeah.
I've had osteopath. I've had acupuncture, normal chiropractic.
Yeah.
A massage. You name it. I've had it.
Okay. And it's still there, but it's
it never
less.
never clears completely. Ever.
Okay. Excellent.
Yeah.
And are you looking forward to today?
Yes, it'll be fun.
Excellent. Thanks very much, Lorraine.
Okay, thanks, Susie.
Okay. Lorraine, how was it?
It was actually really very, very good.
Yeah.
Roberta's assessment was really, really professional. Picked up things that I didn't actually tell her about, how my body was working, the structure of my body. So she actually made some really, really profound assessment changes, and then was great with her patching as how she was actually where she was putting the patches, what she was doing with them, and I noticed immediate relief. Yeah. So it was really good, very, very good.
And can you tell us a story about any part of you that had deep pain and then had a release of pain?
Probably the biggest thing that, like, I had a long-term injury on my hip about 5.5 years ago.
Yeah.
And what I didn't realise was that I always had a lot of shoulder pain, neck pain, things like that. But it's got worse since then. And what she actually said was the hip pain, that the trauma in the hip was actually driving a lot of the structure and the physiology of how my right shoulder was actually working, how my neck was working, and things like that. So when she actually did a lot of work on my shoulder and patched that, but also concentrated a lot on my hip area, I feel like I'm standing really differently. I feel like my body, my right side of my body is actually trying to get strength in it, which it hasn't actually really had, even though that wasn't the trauma side. So
just that overcompensation, and then
and it's it feels like I've got a lot more warmth in my body now as well.
And what were the colour of your toes?
They look normal to me. They were a little pale, but now they're not, so let's not go there.
They look great now, just sad. We'll just give a little. There they are, the little ones. Okay.
Little people.
Yeah. And what would you say for anybody wanting to come and try out ANF therapy?
I would actually say do it. Just do it. It's a really great modality, and it actually gets really good results.
Yep.
So, and I'm someone who's tried everything, and this gives me really, really good results. So just do it.
Excellent. Well, thank you, Lorraine. Have a fantastic rest of your day. And
I will.
Drink lots of water.
Okay, thanks.
See ya.